Hi everyone, and welcome to Babylon's Women's Health webinar. My name is Stina and I'll be hosting today's event. To give you a bit of background about Babylon and International Women's Day, Babylon is a global healthcare company that has a mission to put accessible and affordable healthcare in the hands of every person on Earth. We believe that helping people to live their happiest and healthiest lives is an important step to making that vision a reality. So, in honor of International Women's Day last week, we wanted to give 3 of Babylon's female experts the opportunity to shine a light on the issues that women face every single day when it comes to their health. So this event is a chance to answer any questions you may have around women's health and to highlight the solutions that will help women overcome some of these challenges. Today, we'll be discussing women's health at different stages of life, starting with menstrual health and moving on to sexual health, infertility, pregnancy, and motherhood. Without further ado, please let me introduce you to our panelists. So starting with Dr. Elise Dallas. Elise, can you give us a wave, please? So Dr. Elise is the safeguarding and clinic lead at Babylon, a GP with nearly 15 years experience. Dr. Elise has a keen interest to improve women's healthcare through innovation and new technologies. And during the pandemic, Dr. Elise has been working on the front line as a lead in our Babylon clinics. Her mission is to educate and empower women and their doctors about women's health conditions so that we can expect more in how they are treated and managed. Next up, we have Dr. Kimya Tar. Kimya, can you give me a wave, please? So Dr. Kimya is an artificial intelligence clinician and GP with 10 years of clinical experience and holds a diploma to the Royal College of Obstetricians and Gynecologists. With a keen interest in women's health and innovation healthcare, Dr. Kimya has been developing digital health products at Babylon to meet global healthcare needs. And last, but certainly not least, Madison Levine. Madison is a Babylon's behavioral health lead from New York with an expertise in marriage and family therapy. And prior to Babylon, she worked in community mental health, providing individual, family, and group therapy to adults and children with trauma. So we have a great panel here with us today. So to kick off our panel, I would like to start the session with menstrual health. So Dr. Elise, I'd actually like to start with you on this one first. So periods are a major part of women's life. So of course, it's important for all of us to be familiar with our cycle. And as many of us know, we can experience heavy and painful periods. But how does a woman know if her period is normal? And at what point would you advise seeing a doctor?
Thanks, Tina. Yes, you're right. Periods are often heavy and painful. But what I would first say is that if it's interfering in your life, then you really should be coming to speak to a doctor about it. I see women all the time, who think that missing social events or their work due to their period is totally normal and they just have to put up with it. But this isn't the case because 1 in 5 women experience heavy periods. That's 20% of women, yet only 1 in 3 have ever even remotely discussed it with their doctor. So, but if it isn't, you're not sure if it is a heavy period or not a heavy period, signs that you might want to look out for are that you bleed for longer than 7 days, you change your pad or your tampon every 1 to 2 hours. You might pass blood clots bigger than a 10-pence coin, leaking through your bedding or your clothing, even when you've got maybe a tampon or a pad or both in, and feeling tired or weak during your period, because often if left untreated, and it commonly does, it leads to anemia. So there might not often be a cause found, such as fibroids or endometriosis. Some flows are just heavier by nature. And in about half of women, no underlying reason is found. But just because a cause can't be found does not mean we can't manage them. And the same goes for painful periods, which are very common, with about 80% of people suffering pain of some sort. But about 10% of women experience pain so severely that they're crippled up in bed, taking time off work or school, and it's not normal and certainly shouldn't be accepted. Endometriosis could be a cause of this severe pain, and it's a condition that affects up to 10% of women, yet it takes an average, if you can believe it, 7.5 years to diagnose. So,
wow, why does it take so long to diagnose that?
Well, this is partly to do with the symptoms often being vague, so tiredness, associated abdominal bloating and pain, but also due to the lack of awareness of endometriosis, both from women and their doctors. I would again say key symptoms to look out for, that when you might suspect it. Are you experiencing pain before the period starts and then all through the period? Possibly deep pain when you're having sex, and pain if you're opening your bowels during your period. But the important point is to really go and speak to a doctor, because I think if we all know a bit more about endometriosis and consider this as the possibility of a diagnosis, this can help avoid the long protracted journey so common with this condition.
Yeah, that's really helpful. Thanks for that, Elise. So my next question is for Dr. Kimia. Is there really a link to mood and our menstrual cycle? I'm obviously no doctor, but I imagine this is something to do with our hormones. Can you tell us a little bit more about that?
Sure, thanks, Stina. You're right. So our hormones level change throughout the monthly cycle, and this can affect how we think, how we feel, and it can also affect how we look. And I like to think of the menstrual cycle like the seasons of the year. It's important to mention that every woman's cycle is different and unique to her. But let's, for the purposes of demonstrating this, take the average cycle of 28 days. So day 1 of your cycle is the first day of your period, and this is the start of winter, or the menstrual phase, and it usually lasts around 3 to 7 days. During winter, all the reproductive hormones drop, and this causes shedding of the lining of the womb and the period. So at the beginning, you might feel a sense of relief when your period starts, but during this week, you'll feel quite tired, your energy levels will be at their lowest. So it's a really good time to rest, and kind of this is your thinking and reflection time rather than your doing time. So just take this downtime now. Then after the period is ended, we come into spring, or the pre-ovulation phase, and it's approximately day 6 to 11 of your cycle. So you might notice an extra spring in your step, everything may seem brighter, you might feel more upbeat, happy, optimistic. And just like everything kind of blossoms in spring, a reproductive hormone called estrogen starts to rise, so does your energy levels and your motivation. So now's a good time to get curious, get creative, perhaps with a new project, or think about a change in your life for the better. And then after spring comes summer. So this is the ovulation phase. And this is where you'll release an egg or you'll ovulate. And it's the shortest phase. It's about 2 or 3 days, and your estrogen hormone levels will peak. So you might be feeling more energetic, full of confidence, much more sociable. And you'll also be looking your best, and you might feel friskier. So this is the time to shine, whether at work or at a social occasion, but just make sure that you don't kind of overdo things. And then finally, that leaves autumn or fall. And this is known as the premenstrual phase. And it's around the last week of your cycle. And the estrogen hormone levels will dip, and a hormone called progesterone begins to rise. And this is a hormone all about slowing things down. So you might notice you have less energy, and there's only certain people you want to be around. So this is your chill time. So think about organizing your home office or taking care of something on your to-do list. And it might be really familiar to many of you, but in the second half of this phase, you might start to feel PMS-like symptoms, for example, craving comfort foods or mood swings, or just feeling a bit more sensitive. But it's really important to say that one size does not fit all. So if you think this doesn't fit you, that's okay. It just might be that your hormones are on a slightly different wavelength, or your personality is just more like one season than another. So don't worry about that at all. But I just think understanding how your hormones work during each phase of your cycle can really help you maximize your true potential.
Yeah, that's so interesting. I actually never thought about the menstrual cycle like a season. So basically what you're saying is I could ask for a pay rise mid-cycle then.
Yeah, go for it, Stina.
Madison, is there anything you can share with us about the link between periods and mood as well?
Yes, absolutely. As Kimia touched on, there is PMS, and that is something that most women will experience as a natural part of their cycle. But there is a distinct difference between PMS and PMDD, which stands for premenstrual dysphoric disorder. And according to an article by Forbes magazine, about 3 to 8% of women experience this. So if you're a woman and you're wondering, What is the difference? The symptoms for PMS are much more mild than the symptoms for PMDD. And often women will express underlying conditions of anxiety or depression intensifying around their period. This is a flag as a woman or as somebody in healthcare that this person may be suffering from PMDD. And that consists of at least 5 of the following present symptoms that onset 1 week before your period and usually alleviate about 1 day or the day of the onset of your cycle. And these symptoms include affect liability, which are mood swings, irritability or anger, depression or anxiety symptoms, decreased interest in activities, difficulty concentrating, fatigue, changes in sleep and appetite, as well as physical symptoms such as tenderness or bloating. And as you can see, these symptoms are much more intense than your typical PMS symptom picture. So tips for overcoming PMDD and coping with this is tracking your cycles and mood. If you notice that your mood is changing very greatly 1 week before your period, this is a big signal for PMDD. You can also use mood regulation skills that you would typically use for anxiety or depression, including mindfulness, grounding skills, and journaling. You can utilize your support system around you, such as friends and family, as well as knowing that this increase in symptom picture is temporary. And the one thing that is kind of helpful about PMDD is you can plan for it. The onset timing is predictable. So that's something that can be very helpful in this case.
That's great. Thank you, Madison, for that. It's good to know. I'm going to move on to our next section, which is sexual health. So obviously we can see that mental health issues obviously intensify around periods, but that's not to say that they disappear the rest of the time. So how can these feelings of stress, anxiety, and depression impact women's libido? And Madison, I'll come to you again on this one.
Yes, absolutely. So we have seen romantic relationships shift a lot for both women and men, but for the purpose of this webinar, we'll discuss women specifically. So throughout the pandemic, romantic relationships have shifted because single women and as well as single men have been told to limit their partners due to the virus. In this case, it can create some fear around having new partners due to the COVID-19 virus. For individuals and women who are in relationships, we're seeing higher levels of stress overall, and stress does decrease libido for both men and women. So you see partners of all kind, really libido is lowering. As well as anxiety and depression can also decrease libido for women as well.
Thanks, Madison. I'd just like to add that loss of libido is a really common problem. And as Madison mentioned, it mentions both men and women, and it can affect them at some point in their lives. But it's important to mention that everyone's libido is different, and there's no such thing as a normal libido. But low libido can be the result of conditions like vaginal dryness, painful sex, or a condition called vaginismus. And just to explain a little bit about vaginismus, this is where the vagina suddenly might tighten up on its own. For example, if something's inserted into it, and this muscle tightening can lead to pain or discomfort. And some women describe it as a burning or a stinging pain. So the types of symptoms in vaginismus include painful intercourse, and some women might experience pain when inserting a tampon or during an examination by their doctor. And the severity of symptoms do vary between women as well. But we don't always know why this happens. Sometimes we can't find a cause, but vaginismus has been linked to anxiety or fear of intercourse, for example, past abuse or trauma, past painful intercourse, or other emotional factors. And sometimes it's not always clear which came first, the vaginismus or the anxiety, so it can get complex. And whilst this condition is understandably very upsetting and painful, it can be treated. So it's really important that if you're having low libido, if you have symptoms of vaginismus, that you speak to your doctor, as we can advise treatments such as exercises that you can do at home, or referral to a specialist therapist if it's linked to fear or anxiety. And if you're in a relationship, you can choose to involve your partner. But just finally like to add that other health problems like thrush, for example, or infections, including sexually transmitted infections and vaginal dryness, can cause painful intercourse. And vaginal dryness is something I often see in my clinic. But Elise, it'd be good to get your thoughts on this topic of vaginal dryness. Is this something you also see quite a lot of?
Yes, yeah, absolutely, Kimia. Vaginal dryness is really common, and I see that in my clinic. It's often due to hormonal changes. So I will often see it in those that are going through the menopause or leading up to the menopause. And 70% of women experience some sort of dryness, which can present with itching, painful sex, needing to urinate more often, and even being really uncomfortable to sit down in their clothes. Yet over half of women just think that this is the natural, part of getting older. So, and then they're too embarrassed to come and talk to us about it. So they suffer in silence. But other hormonal changes where I see this is when you're breastfeeding, and also just taking contraceptive pills can cause dryness too. I would say basic measures that you can try are to wash your vulva only with water. And I would advise this, by the way, for all women throughout their life, because this prevents against non-sexually transmitted infections like thrush and bacterial vaginosis. But during sex, if it's dry, to try and use unperfumed water-based lubricants. And if you're going through the menopause, topical estrogen can significantly help. But it really is important to chat to a doctor if these simple measures are not helping, because there might be an underlying cause that's different to what we think it is, and this would change how we manage you.
That's great, thank you for that. So obviously stress is a big player in affecting libido, and as a result this can obviously affect our relationships, and with the added pressure of the pandemic in the mix. From your perspective, Madison, have you seen an impact on sexual relationships throughout this pandemic, and what would you suggest as a tool to help?
Absolutely. So relationships in general are experiencing challenges, and specifically sexual relationships. So therapy can be seen as a tool to help with that. I know both Kimia and Elise had mentioned different areas of sexual changes in women, as well as vaginismus, which both can be well addressed in sex therapy. It's important to make the distinction that sex therapy and couples therapy are very different. Whereas couples therapy focuses more on communication styles, which can be very important as well. Sex therapy focuses more on any sexual traumas, sexual education that somebody may have received, cultural values about sex, and any common issues between a couple regarding sexual intimacy. There are usually behavioral exercises as well as communication exercises that sex therapists do prescribe in order to help the couple get more comfortable. A lot of insurances actually do not cover sex therapy. And so if you can find a couples therapist, at least to open your communication about sex, that could be very beneficial as well.
Great, thank you for that. So moving on to our infertility, pregnancy and childbirth section, and I'd actually like to start with this question. So what can individuals who may not be sure whether or not they want to become a parent in the future, what can we as women do to keep our options open by protecting our fertility? And I'd like Elise to answer that, if that's possible.
Yes, so fertility isn't something that most people think about much before they actively start trying for children, and then they start having trouble. And I want everyone to remember that it's really very common. So we would consider that there might be infertility issues if a couple are struggling to conceive and cannot get pregnant despite having regular unprotected sex. That would be every 2 to 3 days. And if they didn't get pregnant within a year, we would consider this, that they might have infertility issues, because about 84% of couples will achieve pregnancy by the end of the year. So around 1 in 7 couples may have difficulty conceiving. And it's important, again, to remember that infertility doesn't just affect women, it affects both men and women, and we treat them as a couple. But in general, if you're looking to conceive, we would suggest looking at modifiable risk factors that we know reduce chances of fertility. So getting a healthy weight, stop smoking, reduce your alcohol. If you're a woman, take folic acid and vitamin D, and the male trying to conceive, zinc is really useful. And these measures are also part of what we call preconception. And studies have shown actually planning and getting healthy before the pregnancy, before the conception, has far better health and well-being outcomes for the mother and baby than trying to make these changes or reduce these risk factors once you are pregnant. If we're thinking about potential issues you might have, it's really worth looking at your menstrual cycle to give you a clue. So like I said before, painful or heavy periods, or if you suspect you have endometriosis, I would seek help as early as possible because you might have trouble conceiving. It's been shown that about 40% of women who attend fertility clinics have endometriosis. That's not to say that all women who have endometriosis will have problems, but it's worth considering. And this is a condition where the tissue that lines the uterus grows outside the uterus, such as on the ovaries or the fallopian tubes, and it leads to scarring, which can then cause the fertility problems. But also looking to see if your periods are absent or irregular. And by that, I mean, we consider a normal cycle being 28 days from one period to the next. But if your cycle is too long, so over 35 days, or under 21 days, this could mean that you might not be ovulating. You might have noticed hair growing on your face or chest, or be prone to acne issues. And all of these signs could mean that you might have a hormonal imbalance, such as polycystic ovarian syndrome. So my advice would be, if you start trying, is to buy some ovulation sticks, and you can buy these without a prescription. You could use a fertility prediction app, and both of these record the likelihood of you ovulating. And if you feel that these aren't successful, then maybe you could seek help a little earlier if you're concerned. Another one to look out for is pain during sex or discharge. Yes, it could be endometriosis, but it could also be a sexually transmitted infection. Untreated chlamydia is another really common cause of infertility. And this is why we have the screening program for chlamydia. And we recommend testing every year or every time you change your partner, because in women, sadly, there are no obvious symptoms and it can lay dormant until you realize it's affected your fertility. And I think when to seek help, sometimes this depends on your age, because as we all know, fertility does decline with age and it falls sharply after the age of 35. So if you're trying for a baby and you haven't managed to conceive before 35, we would suggest trying to get pregnant for at least a year before we would investigate. If you're between 35 and 40, maybe 6 months after you've been trying. But if you're older than 40, I'd be going to your doctor straight away to discuss.
Great points to look out for, Elise, thank you. And Madison, do you have any thoughts about this issue from a psychological standpoint?
Yes, absolutely. So women experiencing issues with fertility often do need more support. Fertility challenges can cause feelings of isolation, pressures from the family, such as when are we going to have a grandchild? Or often women can kind of take on shame about not being able to become pregnant. On top of that, there are many doctor's appointments, hormonal changes, treatments that take up a great deal of a woman's time, as well as changes in their body. And it's important to know that women can utilize therapy as a support system for somebody who is outside of their life and can offer that perspective in a different manner, as well as provide confidential support.
And Dr. Kimia, in your opinion, how has the pandemic affected those who are pregnant when it comes to healthcare, and how have these changes affected women?
Thanks, Stina. This is a really current question, so I'm really glad you asked it. During the pandemic, antenatal and postnatal care has remained essential. So it's really important that women attend all of their pregnancy scans and appointments unless told otherwise. But having a baby during the pandemic can understandably be a really stressful and anxious time for a woman. And there have been some changes made due to coronavirus. And these were to keep mother and baby and others safe. And this meant that some women had to go through their scans, appointments, and even through their labour alone. And many women are understandably still really worried about whether they can bring their partners with them now. So I could talk a bit about what might look different at the moment. So in terms of scans and appointments, the guidance is that women should be supported to have one person beside them at all stages of the pregnancy, as long as that person isn't showing symptoms of COVID-19. But the guidance is still subject to local discretion, and it may vary depending on the local transmission rates, and also depends on where you are in the world. So I recommend checking local guidelines or with your maternity team if you're unsure about this. And then in terms of labour and birth, yes, women should be encouraged to have one birth partner present with them, again, provided that partner doesn't have symptoms of COVID-19. And we know that having a trusted birth partner is known to make a significant difference to the safety and well-being of both mother and baby. So this is really important to have that support. It's worth mentioning that there may be limits on how long the partner can stay after the birth. So again, it's good to check with the maternity team. And in terms of other changes, where possible, essential scans or tests, for example, routine antenatal care or ultrasound scans, might be offered within a single appointment. And this just means that the total number of in-person antenatal visits may be reduced, but this won't affect the overall care. And then some appointments might need to be carried out over the phone or by video, provided that a test or a physical examination isn't needed. If that is needed, then you'll be seen face to face. And it won't come as much surprise, but masks may need to be worn in the clinic or hospital. And you might also be seeing staff wearing protective clothing. And lastly, I just like to add that we are in a pandemic, we are coming out of it, but your doctors and midwives are here for you. So if you're pregnant and you're worried about any symptoms, or you notice, for example, your baby having reduced movements, you're bleeding, you experience any pelvic pain, you have a persistent headache, or have any concerns, please contact your midwife or doctor, as we are here for you.
Yeah, that's right, Kimia. I mean, yes, I was just going to add, because I've been running the antenatal and postnatal clinics, and Kimra's right. Last year, during the pandemic, partners were often not allowed to join women during scans or appointments. My sister had a baby in November, and she had to attend all of these milestone events in her pregnancy alone. Fortunately, she wasn't alone during the birth, but after the birth, we couldn't even meet the baby except from a distance. So I think the pandemic has really changed the whole postnatal period for mothers and their new babies. And, no longer have they been able to have the family, the friends around for support. And there's a lack of connection around this time. It can make a new mum very lonely. So I would advise to keep in contact with new mums, as many support groups, they've gone online, and to try and have a strong social support network. This can help hugely. And although we can't be face-to-face, video calls can help you feel connected. But very importantly, routine postnatal visits to the doctor at around 8 weeks. So with mum and baby checks and baby's first immunizations, they have been continuing throughout the pandemic and continue on. So please attend these and reach out beforehand if you're worried or struggling, especially with your mood, because baby blues are considered normal maybe within the first 2 weeks. But if these blues aren't lifting, please reach out, because we are here to support you.
Thank you. Good to know. Madison, do you have anything to add to that as well?
Yes, absolutely. Once again, as Elise was saying, if those symptoms persist, something to consider as well is postpartum. But addition into considering postpartum, we do need to connect and stay in tune with the communities that we are a part of. And for new mothers, that's something that really has not been present throughout the pandemic. So although we are isolating, this does not mean we have to lose connection. Ways to keep connected with a social circle are hosting those virtual events, keeping weekly phone calls with family members or friends who are significant in your life, as well as engaging in communities virtually, such as groups for new mothers. And something else that many clinicians specifically among mothers that we've been seeing is their children developing an insecure attachment style. So attachment theory is something that was pioneered by John Bowlby and Mary Ainsworth. And it basically considers the first 18 months of a child's development to be the most significant to attachment to their caregivers, which can be mothers, fathers, or other guardian figures as well. So secure attachment is the goal, meaning that children can separate from their primary caregiver. In this case, we'll say it's the mother, and be able to self-soothe. So they might cry for a few minutes, but then they're able to kind of calm themselves down. In insecure attachment styles or disorganized styles, you'll see a myriad of behaviors that might ensue after a parent leaves. But since mothers and children are at home together during the pandemic for extended periods of time, children aren't getting that individuation from their parents, from their primary caregiver. Once again, for this case, we'll say their mother. And this attachment style can impact their relationships further in life.
Wow, that's so interesting. Thank you for that. We've actually reached our time on the panel discussion, so I would like to now open the floor for questions. So for anyone who would like to ask a question, please feel free to raise your hand or use the chat function in Zoom. We have already had some questions come through already, so I'll start with a few of these questions and then I'll go back to the room. So the first one that we had come in, and I don't mind who wants to answer this, but first question: how can mothers set healthy boundaries with their children? Who would like to take that one?
I can, if that's okay with you all. So I work with a lot of parents. I also have a background in children's trauma. And a lot of times I see with mothers in particular, sometimes they feel like they always want to be around their children, or they feel like their children are kind of get anxious when they separate from them. And having this separation and togetherness is both very healthy. So it is okay to set boundaries. One way I might say of doing this is spending an appropriate length of time in a different room than your child. Depending on the age of your child as well, this might differ. You also can create a schedule for yourself and for your kids, even if it's at home. We have been in a prolonged pandemic, and so schedules kind of went out the window for a little bit, but they can come back. And this can be helpful for kids to have their alone time too. You can also have a family discussion of how circumstances have changed, and it has changed for both mothers and for children, depending once again on the age of your child. So everyone's experiencing that change. It's okay to talk about it and be open about it. And remember that it's natural and healthy to have both time together and time apart.
Great, thank you. And another question: has there been a rise in stress-related issues during the pandemic? We'd like to take that one on.
I can take that, but at least if you'd like, I know I've been talking, so at least you can go ahead and I can tag along.
No, you go ahead.
Oh, okay, all right. Sorry. So there has been obviously a rise in stress, anxiety and depression levels have been going up as we have been experiencing trauma on a global scale. Women have been hit particularly hard with stress associated with the pandemic because often, not always, they are the parent who is doing primary caregiving while working and managing the home. And this is not always the case, but this is something that we are seeing more prominent in women. And according to the CDC, about every 2 out of 3 women are caregivers, either for elders or for children. So they're taking on this role in addition to working from home, in addition to also feeling the stress from the pandemic. In addition, as we just stated, women who are pregnant are attending doctor's appointments alone, navigating the system during pregnancy alone. And another big topic is women in domestic violence relationships who are isolated from outside resources and contained in a dangerous environment.
I'm just going to look on my Zoom chat. I've seen some come in already. I've got one come in saying, how does the combined pill affect the hormone cycle of periods, libido, and depression? I know we've covered this already, but maybe we can go into a bit more detail if anyone had any additional comments to add to that.
We've slightly gone into it before, but so the combined pill contains estrogen and progesterone, and it depends maybe what the way you sometimes take it, because sometimes you can take it 3 weeks on and then you might have a pill-free break. But essentially what we're trying to do is stop the ovulation and stopping you getting pregnant. So you may not have those highs and lows so often. It can be used for premenstrual tension, or PMS as we call it, for mood. So it can be used instead of an antidepressant to actually stabilize the mood. I'm actually a big fan of hormones. Some people say, oh, I don't want to take any hormones, but when there might be a hormone imbalance or you're having severe PMS or moods like that, it might be worth trying it out. But on the other foot, that it can sometimes cause low moods. So I would always say with any hormonal treatment, try it for 3 months and see how you are at the end of that. But give it a go. If obviously there are no contraindications, because estrogen has some risks attached to it, but go and talk to your doctor and discuss maybe what suits you.
Right. We also had a question pre-submitted before about are combined birth control pills and progesterone only pills equally as effective for managing endometriosis?
Great question again. So yeah, so I've mentioned endometriosis quite a number of times throughout this webinar, but I just want to say that there isn't actually a cure for endometriosis, and it can be quite difficult to treat. And generally the aims of treatments are to ease the symptoms, so the condition doesn't interfere with your daily life. And the aim of the hormone treatment is to stop the production of estrogen, because this actually encourages the endometrial tissue to grow and shed and cause the pain and the problems. So as mentioned by the person that asked the question, you can have the combined pill, which is estrogen and progesterone, but you can have other progesterone forms of contraception that comes in the pill, as the person asked, but it can also come in the IUS, which is like the Mirena coil, the hormonal coil, the contraceptive injection, or the implant. And most women find their endometrial symptoms will improve with hormonal treatment, and many get considerable relief. But in answer to the question about which one's best, evidence actually suggests these hormone treatments are all equally effective at treating endometriosis, but they do have different side effects. So that's the bit that you've got to go along and discuss with your doctor to see if it's suitable for you. And like I said before, I would always say try a hormonal treatment for at least 3, possibly 6 months to see if it suits you, and then go and have another chat with your doctor if it's not.
Great, thanks, Elise. Also had another one come in just now. I've had a child and trying to have another child for 2 years now, and I've had a miscarriage during this time. Is it possible for a miscarriage to affect future pregnancies?
Yeah, I can answer that. Thank you for your question, and I'm really sorry to hear about your experience, and I really hope that you're okay. And it can be a really difficult time going through a miscarriage. So I can completely understand, why you're concerned about, whether it's going to affect you having another child. There's no evidence to show that having a miscarriage will directly lead to reduced fertility. So if that provides you some reassurance, then there's nothing out there that I am aware of, and Elise, I'd like to hear from you as well, but please be reassured that that wouldn't directly cause reduced fertility. I believe you also mentioned that you were trying for 2 years in the run up to the miscarriage. So it would be worth having a chat with your doctor about this. Naturally, if you haven't already been provided with some support, they can do that, but I'm sure you have been provided with that support. But equally, you can also discuss that with your doctor if you hadn't already, and just your doctor will have more information about you. As Elise mentioned earlier, there's lots of different factors that can lead to reduced fertility.
How would I know if I'm going through the menopause? What's the symptoms there? Anyone for this one?
Yeah, sure. It's a really great question. And it might be worth starting off just by defining the menopause. And all it means is your last period. And when we say going through the menopause, we can think of that also as a kind of run up to the menopause, so the perimenopause. And this is when the periods might start to become less frequent over a few months or even years, and they eventually stop altogether. And the hormones in the body become more imbalanced and the estrogen levels reduce, and this is what leads to these symptoms. And in the UK and the US, the average age is about 51, but it can range anything between 45 and 55, and it does vary across the world as well. And it's worth noting, because your question was about whether you know that you're going through it, but it's worth mentioning that whilst the average age is 51, a very small proportion of women might go through an early menopause under the age of 45, or premature menopause under the age of 40. And these are much less likely, but they can happen naturally. They might run in families, or this could be as a result of the side effects of some treatment. So if you're experiencing that early menopause or premature menopause, it's really important to speak to your doctor. But in terms of symptoms of the menopause, so I mentioned the sort of less frequent periods and the run up to the menopause, but there are other symptoms that are really common. And women commonly do experience symptoms of the menopause. Sometimes women don't even realise that their symptoms are due to the menopause because they're so wide-ranging and so varying. But the most common symptoms are hot flushes or night sweats. But there are so many other symptoms, and they can be so severe in some women that they affect their home life or their productivity at work. And these symptoms are hair or skin changes, vaginal dryness, as we've mentioned before, generalized aches and pains, feeling quite tired. Some women notice loss of libido. PMS might get worse. And interestingly, some women experience palpitations or an awareness of their heartbeat. And many women that I see report this symptom called brain fog. So poor memory or difficulty focusing, and this really affects them at work, and they're really struggling with this. And other symptoms include poor sleep or headaches or worsening migraines. I do see that as well. So I think it's also worth mentioning that, as we've mentioned, with hormones affecting our mood, so naturally, because menopause is a result of a change in hormones, this affects women's mood as well. So it can cause anxiety, mood swings. Some women get quite low or tearful. So if you have menopausal symptoms that are troubling you, or you're experiencing any symptoms before the age of 45, as I've mentioned before, please speak to your doctor, as we can confirm the diagnosis. Because these symptoms are so wide-ranging, that's really important to do. And also we can recommend treatment to help you with your symptoms and also help prevent any of the long-term effects of the menopause. So yeah, there's lots that we can do. So come and see us.
Great. I've also had another question just come in. In postmenopausal women, what is your opinion on the use of progesterone for sleep issues and the use of femring?
I mean, in terms of a hormonal treatment in the postmenopausal period, so that would be, so I'll go back one step in the fact that, you know, we should really start thinking of menopause as a long-term hormone deficiency and not just about the symptoms. And the hormone deficiency of low estrogen leads to long-term health conditions. So heart disease, diabetes, thinning of the bones, dementia. And so when we think of treatment in postmenopausal and perimenopausal, you know, we never had to think of this before, because 100 years ago, we would pretty much die after the menopause. But now we're living in our 80s and 90s. And so we need to look at replacing this hormone, estrogen. And that's in the form of what we call hormone replacement therapy, so HRT. And the vast majority of women under the age of 60 can take this. But sadly, the majority of menopausal women are not taking HRT despite it having more benefits than risks. The person who was asking about the progesterone, the reason progesterone is in there is that it protects the womb lining. So we can't just have estrogen on its own if we have a womb. So you would always combine it with a progesterone just to protect your womb. If you don't have a womb, because you've had a hysterectomy, for example, you can just take estrogen. In terms of the progesterone and helping sleep, so I don't know what the other part of the question is, but I presume it's an estrogen as well, because that's the main hormone that you're replacing. You wouldn't just take progesterone, but therefore both of them help together. And there's so many different types. If you are, you know, there's patches, there's gels, there's pills, and there will most likely, as you know, because we've had this fear about HRT, but like I said before, most people can take it. They've just got to find a specialist that will be able to find a type that's suitable for them. You know, at the moment, people are being prescribed antidepressants because of the mood changings and the insomnia that we were just talking about. And it's inappropriate because HRT actually works better. So yes, I would think that will help with the insomnia and sleep issues, because again, in turns, it helps with the mood problems and anxiety, another cause of not being able to sleep. So I hope that's answered your question.
Thanks, Elise. I've heard there's been a rise in domestic violence during the pandemic. Are there any tips for women that feel unsafe with their partner? And I know, Elise, you're a safeguarding lead. So do you want to answer this question?
Yes, no, that's right. We know the pandemic has had a detrimental impact on the safety and in the lives of those who suffer from domestic violence, because home might not be a safe place. We've seen, even within Babylon, we've seen an increase in our patient population of domestic violence. And, you know, there's been a combination of factors. There's more people working from home. There's been school closures, financial stresses, increase in anxiety, deteriorating mental health, increased substance abuse. And the implications of all this is that it builds up like a pressure cooker at home. So, you know, my advice would be, if you are suffering from abuse, and I'd like people to remember that domestic violence isn't always physical. You know, it can be an incident or a pattern of incidents of controlling, coercive, or threatening, degrading and violent behavior, including sexual violence. And also, I just want to mention, I know this is a women's health webinar, but it does happen to men as well. But my advice would be to talk to someone you trust about it. If you are that somebody, it's really important to let that person know that you believe them and you can offer support. Support can be helping to provide information by contacting specific organizations that offer to help those that are abused. And we're going to leave some links at the end of this webinar. They can help explore your rights and available options, because people are often afraid to leave because they don't know what's available. And obviously, please speak to a doctor. We're always here to try and help you through that. If there's an emergency and you need, I would always suggest calling the emergency services. But I want people to also be aware that in the UK, there is something called the silent solution, which enables someone who's called 999, but they're unable to maybe speak because they're too frightened, to press 55 when prompted. That's 55. And this will inform police that they're in a genuine emergency. And I also want to, make people aware that leaving a violent partner is a process. It's definitely not a single act. It takes, on average, 7 attempts before a woman is able to leave for good.
Thanks, Lee. Thanks for that. Madison, do you have anything else to add to that at all?
Yes, so I appreciate all that helpful information that you added, Elise, and we've definitely seen a rise in domestic violence through the pandemic. Therapy has been specifically challenging for women, and again, men do experience this as well, because they're in the home receiving therapy, whereas before they would go to an office and they could speak more freely. Now women are in their homes receiving therapy, so it's harder to communicate. So as a therapist, some things that I put into play that help in these situations are using the chat function, so messaging through text versus verbal communication. This can be helpful because it's not being spoken out loud if the person is in their unsafe environment. You can also create or do your best to create a safety plan. There is a good outline on how to do this on the domestic violence hotline homepage, which will also be included in the resources. Also coming up with code words. If you have friends, come up with a code word that you don't normally use that lets that person know, like, hey, I'm in trouble, like call 911, or, help, like do something, come get me, like action in place. A word that you might think of as like rainbow or caterpillar, like things you would never say otherwise. And the domestic violence hotline homepage has very good quick exit out functions. So there's always that option for you to click a button really fast and it brings you to a completely different page, and it will direct you to a neutral site. And so the domestic violence hotline actually did a study from March to May of 2020. And in the pandemic, they saw a 6% decrease in phone calls for March of 2020 due to survivors being in close proximity to their abusers. And in April 2020, the hotline volume increased by 20%, plus the shelter-in-place regulations began to lift. So you can see that survivors were really unable to reach out for supports. So if you know somebody, or if you are somebody who is in a domestic violence situation, please know there's support for you. Come up with a plan, and if you need it, you can always use it. Hopefully you don't, but if you do, it is there for you, and mental health providers are there for you, doctors are there for you, and we'll do our best to support you in whatever situation you're in.
Thank you. Thanks so much for that. I'm afraid we are out of time. We will be, once we've wrapped this all up, we will be sharing, actually, right on time, this is some UK and US based support helplines. So please feel free to use those. I've noticed loads of questions come in as well. If you do feel comfortable in emailing us, I can pass on your questions to our lovely panelists to answer. So that's events@babylonhealth.com. Thank you everyone for joining us here today. It's been fantastic listening to our experts, and thank you once again, and have a great day.